Okay, so bathroom cycle. So with MMIHS, we have problems with a large bladder. And so Maliyah's is definitely a larger bladder and it can hold a lot. So oftentimes she can't tell like when she has to go shishi or, urinate, or we have to encourage her to go. So first thing off the bat, when she wakes up, we have her empty her bladder. And she could be in there for a while because it takes her a while to empty out. Sometimes it's 700 mLs, which is a lot that she has in there. And then we try and have her go empty her bladder and whatever she needs to do every 2 to 3 hours because she has a tendency to get UTIs. And with the UTIs, you'll definitely know when she does get one. It's either if she's dehydrated, she's not eating as much or drinking as much. We try and stay on top of it. One thing that helps is also just relieving herself every 2 to 3 hours. That's something that you definitely have to encourage her to do.
What happens when she gets a UTI? What's the first response?
Okay, so first response when she gets a UTI is I'll usually contact her PCP, which is Dr. Grace Galiza, and we have a protocol, a standing protocol, standing orders already, where we can just drop off a sterile urine sample that we will have collected, and we drop it off at the lab. They will run it, and usually they'll prescribe a medication, Bactrim, that usually covers, I would say, 90% of her UTIs. That way we can get that on board and relieve her symptoms.
First thing though, once she starts developing those symptoms, it's going to cause a lot of pain.
Yeah, and so usually I'll usually notice that she's going to get a UTI if she has urinary frequency, like where she has to go to the bathroom often, even before the pain. So if she has to go, because usually she can't tell as often, like she can hold it all day if she wanted to. But if she has to go like every 10, 15 minutes, then I'm like, oh no. And oftentimes you can offset it. If you catch it early enough, you can give a bolus of 400 mLs LR and get her rehydrated. And sometimes it'll ward it off for a little bit. But if not, then
Tylenol right out the bat though.
Oh yeah, Tylenol, whatever the dosage is. It's usually right now with her weight, it's about 7.5 mLs
Of children's Tylenol.
Of children's Tylenol. We'll give that through the G tube, and that'll help with the pain. And then once we get the right antibiotic on board, it usually take 1 to 2 doses for the symptoms to get better. Usually it gets better after the first one, but for it to go all the way away, it usually takes 2. So the other thing that we do at night to help prevent the UTIs is we have her wipe with a clean wipe in her vaginal area where the urethra is, and clean that. One swipe down, fold it over, one swipe down, and clean that area. And then we do like 2 to 3 drops of coconut oil with a syringe, and she can do that too. And then that has definitely helped with the UTIs. Anything I'm forgetting?
Oh, the gas.
Oh, when she's bloated and not feeling good, we have her do a couple things. First, we'll have her go to the bathroom and try and see if she can get some stuff moving. The next thing we'll do is we'll usually vent, and we have that in another video. The third thing we'll do is have her try and pass gas. And she'll go upside down on her head, and she'll try and pass the gas. And a lot of times, I would say 7 times out of 10, she'll be able to pass gas, and then that will relieve her tummy problems.
You'll be able to tell when it's a little sloshy. It sounds like a barrel and water kind of sloshing around in a barrel. It'll be really kind of gloopy.
And it'll, like, when she rolls over, you'll hear the water, and it'll kind of tinkle through, almost like
Yeah, gloop, 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 gloop,
like
gloop, gloop, gloop,
be
gloop.
sloshy, like do 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 do. You could hear that it's water or liquid in her tummy. So if it's liquid, either you can try draining if it's still in her stomach, but if it's down lower, then you'll just have to wait for it to pass through. A lot of times it might be diarrhea if it's that gloopy.
Okay.